Cold agglutinin disease, CAD, is a rare, severe blood disorder. It's a form of autoimmune hemolytic anemia, which means the immune system mistakenly attacks and destroys red blood cells. In cold agglutinin disease, certain abnormal bone marrow cells produce antibodies called cold agglutinins, which activate a part of the immune system known as the complement pathways. This activation results in the constant destruction of red blood cells, known as hemolysis. Here's how it works. The cold agglutinin antibody mistakenly attaches to a red blood cell and activates the complement pathway. The pathway starts with a protein called C1 binding to the red blood cell. This leads to a complex chain of events that marks the red blood cell for destruction. At the end of the pathway, the marked cell is destroyed. This destruction is known as hemolysis. In people with CAD, the destruction of red blood cells, or C1-activated hemolysis, is happening all the time. It can cause anemia, along with severe fatigue. That's because red blood cells are destroyed prematurely and are not able to do the vital job of carrying oxygen throughout your body. If your organs and tissues don't get enough oxygen, they can't function normally, making you feel tired. Recent studies have shown that CAD may be more serious than previously thought. A 10-year review of the medical histories of people with CAD showed that they had higher risk of stroke, heart attack, or blood clots. Additionally, patients with CAD are also at risk of experiencing sudden drops in their hemoglobin that may require emergency treatment. Though researchers are getting closer, there are currently no treatments approved specifically for cold agglutinin disease. Research is being done every day to find more answers for people living with this rare condition. Sanofi Genzyme is committed to transforming the care of people living with rare blood disorders.